My name is Federico Asch. I'm a cardiologist at MedStar Washington Hospital Center, Associate Professor of Medicine and Cardiology at Georgetown University, and I serve on leadership committees at the American Heart Association and many other national professional societies. As a cardiologist, my patients come to me with a heart attack, or they come with a stroke, or sometimes they cannot even come to me. Their families do because they died. I don't need to get into repeating what has been said over the last hour or so, but I do want to say that in our community, people that are mostly affected are African Americans, Latinos, and low-income residents who smoke at the highest rates in DC. This bill is strategically critical for decreasing tobacco use in DC. It can actually do it in two very different ways, very important ways that are scientifically proven to succeed. Number one is to disincentivize smoking. I'm not going to get much again into the details of what has been described very, very well. Number two is that those funds must be dedicated to proven programs that help people quit. In fact, I recommend that the bill be changed to devote 30% of tax revenues to cessation. Let's pause here for a moment and do a little bit of math. The CDC has recommended that DC invest $10.7 million in tobacco control. The American Cancer Society estimates the proposed tax increase will raise $5 million new dollars, putting the total annual revenues in DC at about $35 million. Investing 10% of those would provide $3.5 million to tobacco cessation programs, barely 1/3 of the $10.7 million needed, according to the CDC. Investing 30% to cessation would put the district in line with the CDC recommendation and is therefore what I urge you all to consider. That would support the tobacco control programs that DC needs and still provide $25 million in other revenues to DC. This is a fundamental issue. We want to help our people. These are addicts. This is an addiction, and they cannot do it by themselves. For all these reasons, and for the health and welfare of all residents of DC, I ask you to support this bill, raise the tax on cigarettes, invest at least 30% of tax revenues in cessation programs, and do everything we can to help all residents stop smoking. Thank you so much, and I'm happy to get any questions.
Mr. Asch, I'll ask you, because you probably would know easily the answer to this. Have you ever seen an X-ray of a lung from somebody who's been smoking, who's been a smoker?
Every day.
Every day. What do they look like?
They can look many different shapes, none of them good. I can tell you that you can tell a normal X-ray from someone that has been smoking for a long time from far away. Even our first-year residents or our medical students can do that. It's the first thing you learn in medical school.